This was based on a regimen that we designed in the late 1990s, which was designed for older patients. The typical myeloablative regimens that we discussed in the one paper only applies to patients less than 60 years of age. However, most of the myeloid leukemias or myelodysplastic anemias or lymphoid diseases are actually in older patients. So patients median age of 65 to 70, that's where the highest prevalence is. And so in order to design a conditioning regimen that could be tolerated, we developed a regimen that consists of low-dose fludarabine and a low-dose total body irradiation. And that regimen has been applied now to more than 2,000 patients. And it can be done in the outpatient setting. So the patient comes to Seattle and gets analyzed, evaluated. A donor has been identified, and the patient goes through the transplant in the outpatient department. If they're living within a half-hour driving radius of the center, they can live at home. If they are not, if they're from out of town or somewhere, then we have about 150 apartments close by where they can live. And the only time they get admitted, if they, say, develop a fever, then we have a very short trigger. We put them in the hospital, or graft versus host disease or something like this. But the median hospital stay in that study was 6 days, so very short. And the patients and their family members who support them really appreciated being in an outpatient setting, because it's so much easier to live at home than have to travel every day to the hospital and look after your family member, etc. So half of the patients were actually able to stay entirely outside.